Welcome to the PM&R Scholars podcast. The PM&R Scholars is a group of like-minded individuals focused on collaboration, mentorship, research, and networking opportunities in Physiatry. The Road to Residency series will feature on-demand sessions with leaders in the field to bridge the gap to residency. Follow along as you start your rehab journey. This episode was recorded from a live event with an associated dynamic PowerPoint, which you can view on the PM&R Scholars YouTube channel if you are listening to it as a podcast. Also, please note that this episode will only feature the presentation portions of the event. My name is Hye-Jin, and I will be the moderator and host for tonight's event. And we have a very esteemed powerhouse of panelists tonight, and I'm so excited for them to join us. And they're going to actually be introducing themselves throughout the panel and to keep things moving along. So without further ado, we're going to dive right into our panel tonight. And just to get us started, what is PM&R Scholars? So we are a group utilizing social media to promote education, research, networking, and mentoring for the future of this field. And while we are PM&R focused tonight, we are actually going to ask everybody who's not going to PM&R to just keep an open mind and get to learn a little bit about what we are as a field. So our purpose and vision of the event is the following. So we have 4 pillars. So for our M1s, M2s, as well as our pre-meds, or even some of our M3s tonight, we want to give you some exposure to physical medicine and rehabilitation, also known as PM&R, also known as Physiatry, as a specialty, as this is not your core rotation. And for all your M3s, all the M3s out there who's getting ready to apply this coming application season, we would like to give you some insight into the residency application process, especially from the Match 2022 cycle candidates. And this applies to anybody regardless of the specialty that you're thinking of pursuing. And we want to ask you, give you a space to provide and also give you space to ask questions to the MS4s who have matched successfully this past application cycle. And last but not least, we want to mentor you and pay it forward for the next generation. So our agenda is the following. It is a packed schedule, so we're gonna move right along. We're gonna be quick, but we won't hurry. So we'll kick off with Dr. Liu, who's gonna give us some insight into Physiatry and PM&R. And I won't read this to you, but our esteemed panelists are gonna actually take a topic and go through these, and these will essentially be 5 minutes each. And then we'll actually cap it off with some Q&A discussions with the Match 2022 candidates and share some helpful resources with you. And we actually, as we go forward, just a couple disclaimers. Any mention of the specific residency programs or resources in this particular presentations tonight is not a form of endorsement or promotion. And the panelists not speaking on behalf of, or actually not speaking on behalf of their Match program, but we are just merely speaking based on the information we gathered as from our personal experiences from this past Match 2022 cycle. And last but not least, please do not screenshot anything tonight just for, I guess, some security purposes, because we will be giving you a post survey at the end. And for whoever fills that out, we will actually send you the PowerPoint tonight. So we'll just kind of be cooperative on that end. All right, so without further ado, I'm going to be introducing our first panelist on the board here with us. So Dr. Liu. Dr. Liu and I actually met on the interview trail, and he's fantastic as a person. I'm so excited that he's here tonight. He's a New York native. He completed his residencies at Rutgers and New Jersey Medical School, where he was a chief resident in his senior year. And for the fellowship, he actually did a fellowship in intervention spine and musculoskeletal medicine at the Hospital for Special Surgery out in New York City. And he's currently an assistant professor and associate program director in the Department of Physical Medicine and Rehabilitation at Rutgers, New Jersey Medical School. Dr. Liu, welcome. And I'm going to actually allow you to share your screen so you can give us a fantastic presentation that I wish I had when I was a medical student.
Thank you for the warm introduction. And I will attempt to share my screen right now. I feel very old sometimes because during the interview cycle, I wasn't in charge of all this. But yes, me and Hye-Jin go way back. As early. And actually, first things first, a warm congratulations to all the matched applicants. This year was pretty competitive, as it has been in the past several years. We only had, I believe, 2 unmatched or unfilled spots in the country that have now been filled. So without further ado, let me just jump right in, since I know that we are a little short on time today. So hopefully everyone can see my first slide, physical medicine rehabilitation. Credits for this slide set comes from our department. So we do have a 2-week mandatory rotation for all 4th year students. And pretty much all these slides, except for the last 2, come from that PowerPoint presentation. So credit for my department for providing me with the fodder here. So what is PM&R? So it stands for Physical Medicine and Rehabilitation. We go by many names. Some of us call ourselves physiatrists, others call ourselves physiatrists, others call ourselves rehabilitation physicians. But no matter what we call ourselves, PM&R is a field, a branch of medicine, sort of focusing on the prevention, diagnosis, and treatment of disorders related to nerves, muscles, and bones. These are some of the words that are commonly associated with our field. It's a complicated name, admittedly, because of the different disorders that we see. So the physical medicine part, it does relate to the musculoskeletal realm mostly. And by musculoskeletal, I mean conditions affecting the spine and peripheral joints, including the entire axial spine, shoulder, hip, knee, you name it, we can treat it. These issues can be acute or chronic conditions, and we see all sorts of stuff. The rehabilitation part is actually equally interesting. A lot of our rehabilitation patients are patients with a host of disorders, some of which include stroke, spinal cord injury, traumatic brain injury, other CNS disorders such as MS. We also treat cancer patients, amputees, polytrauma survivors, and also a lot of patients who have just undergone your typical joint replacement surgeries or spine surgeries. So no matter what we do, which subspecialty that of PM&R you end up choosing, our aim as physiatrists is to really restore functional ability, independence, and quality of life to our patients, and to do so in a way that preserves our patients' dignity in key areas of their personal, social, biopsychosocial, vocational domains, and also psychologic domains. Physiatrists, we're also specialists in pretty much different aspects of care. So we pride ourselves in taking a thorough history, performing a very thorough neuromuscular and orthopedic examination, and we correlate everything with labs, radiology, and also different kinds of diagnostic tools such as ultrasound, electrodiagnosis. Electrodiagnosis in particular gives us the ability to diagnose and prognosticate disorders of muscle and nerves, such as radiculopathy, carpal tunnel syndrome, myopathies, and many more. So the things that I mentioned already are things that you may see in your typical PM&R rotation, probably on a daily basis, honestly. So what is different about our field? What makes it stand out? Well, really, a lot of times when I explain our field to other people, I sort of tell them that it's an intersection of different subspecialties. You probably wouldn't like PM&R if you hate neurology or you hate orthopedics or sports medicine or rheumatology. We're a combination of everything. Those theory, maybe radiology, maybe a little bit of medicine, but really what makes us stand out is we're not really married to a particular organ system. We're married to the idea that we can improve function. So anything that impacts someone's function is something that we treat. So these are some of the questions that we ask ourselves on a daily basis. You can read this slide a little bit later on, but really, even as a musculoskeletal person, I ask that, but the same questions could be asked of my spinal cord injury friends at Kessler. And in addition to sort of taking our history and performing our exam and working people up and diagnosing things, we also prescribe a lot of different things for our patients to help them get better. So it can range from something like medications, oral, topical, to a lot of different physical therapy, occupational therapy, all different sorts of therapies. Because really our therapists are the backbone of our treatment paradigm, because a lot of people do not know what therapy really is until they've met us and met the therapists. And of course, you're at home a lot more often than you are in any therapy session. So we do have a heavy emphasis on things that our patients can do at home to improve their function. And when everything else fails, and when things, or when the pain or something becomes really acute and interventions are desired and appropriate, we do perform a lot of injections, actually, a ton of different procedures. We treat the spine, peripheral joints, spasticity, and we also, in recent years, have put a lot of focus on regenerative therapies. So our injections can be landmark-based, they can be EMG guided, they can be ultrasound guided or fluoroscopically guided. And of course, the last is probably most important. We have a ton of follow-up. with our patients. And we're proud of this. And so we see them all the time. We see them throughout the course of their lives, after, before, during injuries. And so a ton of time is spent counseling and educating them and providing them anticipatory guidance for their future. So when needed, we also prescribe prosthetics and orthotics. So, take-home message here is an orthosis is pretty much a device or appliance that corrects or straightens or supports or accommodates or enhances the use of a limb. And so these are your typical braces, such as your AFOs, your spinal orthoses for scoliosis, and a host of splints and other devices. A prosthesis, by comparison, is an artificial limb or body part that replaces or substitutes for a missing body part. Oftentimes resulting from amputation or some kind of congenital development. All right, so other common conditions we treat are spasticity, like I mentioned. It can be from a variety of nervous system disorders, and we treat by use of oral medications and also injections of botulinum toxin. Botox is just one of several formulations. So as you can see, we can perform these injections sort of landmark based, also EMG guided, ultrasound guided. And when things sort of fail, and spasticity can be severe and refractory to all of this, that's when we start thinking about implanting a backflow pump, which pretty much threads a catheter through the spine and delivers the medication directly to the spinal cord, with a pump usually placed and implanted in the abdomen. And we're also pain specialists. All right, so many of our patients suffer from pain and they require a multidisciplinary approach to the treatment. And part of this is your therapy. Other parts are cognitive behavioral therapy, acupuncture, PT and OT. And when indicated, we do perform a host of injections. And so, for these particular procedures, you typically would require fellowship training, either interventional spine, which I did, or pain management. And of course, the subjects of research that fall within our purview are numerous, from mild TBI to concussion, to powered exoskeletons, to brain-computer interfaces, to safety and efficacy of a variety of somato interventions, and also a lot of orthobiologics research and regenerative medicine research in recent years. So like any other field, new questions pop up all the time, and we're constantly trying to answer them. With regard to practice settings, we are very well suited to working in inpatient setting, outpatient setting. A lot of times, your general physiatrist who does not complete fellowship training is well versed in doing a little bit of both. It's quite easy to have great MSK training and outpatient training and marry that with your general rehab and inpatient training to have a very varied practice. For those of us who subspecialize into the variety of fellowships, which I'll touch upon in 2 slides, you do tend to favor one over the other. And this is our interdisciplinary team. So we work very closely with not just allied health professionals, but also different branches of medicine and different specialists. So everything that you see here on the left side of the screen, there are specialists that we cross-refer with and to on a very frequent basis, and people who we interact with all the time. So all my patients, for example, I oftentimes sort of ask them, especially for example, like a diabetic patient who's here for like a steroid injection, I would ask them about their diabetes, how it's managed, and where I practice, sometimes it isn't managed. So then we would sort of cross-refer, and so it becomes super, super important for you to know who your team is, both in both realms, on the left hand side of the screen. So with regard to fellowships, you have a ton of fellowships to choose from if you so choose. Fellowship training should be pursued if you wish to become an expert in one or more areas, and or if you want to be able to offer a particular kind of procedural skill to be able to help your patients. So I bolded the most common fellowships chosen by PM&R trainees. So now we move on to the last couple of slides, advice for applicants. So basically I try to keep it short, 3 to 5 main pieces of advice. The first one's the most important one, choosing your medical specialty. This is something that, you should not be wondering to yourself, how can I retire early, this and that. You should ask yourself, can I do this every single day for the longevity, for a very long time, 30 years career, right? Will I come in on a weekend and do this? Do I, on the flip side, do I dread coming into work every day? For you to sort of choose the right field, you have to know who you are and what you want and what excites you. So typically that might mean, what subject matter interests you most. That's a great starting point. But also too, the second bullet point, it starts and ends with the patients. So for me personally, I thought to myself as I was choosing PM&R, is this kind of pathology what I want to see, right? would I read about this even if I had a day off? And it turns out I do. And also where you fit into the continuum of care. So prevention, palliative treatment, do you want to see someone after all the things have been taken care of, or do you want to prevent things? So for what I do, I want to prevent that spine surgery. Sometimes I even want to prevent them from needing an injection. And so that's what makes me happy. And that's why I chose what I chose. And also your impact for your patient, right? How do you like to impact patients? Is it doing something physical with your hands? Is it, prescribing the right medication? Is it counseling? Luckily for us, PM&R is everything when it comes to that. So the third point I have is to really seek mentorship. And so really seek it. And, it's not as though you're going to wake up one morning and mentors are going to be coming from the sky and just raining everywhere. Sometimes it can be a little challenging, especially if you come from a home institution that doesn't have a PM&R program like I did. So I went to Stony Brook Medical School. We do have a PM&R program, but the residency is sequestered an hour away. So I didn't really know about it until my late third year of medical school. But I could have found out. I could have been a little more proactive. But right now, by virtue of the fact that you're on this panel, you already know that reaching out to social media, graduating and match students, it's a great resource. They're a great resource. Everything should be taken with a grain of salt because you're your own person. However, a lot of people have gone through that same thought process and that same, application process, and you should benefit from their wisdom. And also, too, if you have the ability and the luck and, to rotate in PM&R somewhere, either in your home institution or away rotations, interacting with residents and attendings, picking their brain, it's a great way to get honest opinions. We tend to self-select for great people. I've been very blessed to say that this is our typical physiatrist is a great person to begin with. And so if you ask, you pretty much should receive for the most part. And if that's not possible, then you can also go to the AAP website. I know that AAP&R also has like an official mentoring program, but I believe that's more for early career people like myself. But for AAP, I think even as early as medical school, you can go to that link and sign up, and they'll pair you with a mentor if you so choose. And really quickly, the last two things, be a team player, all right, go out of your way to do so, try to meet other like-minded peers. This one thing will translate to everything. So throughout medical school, it'll change residency culture. It'll change the way that you are able to provide patient care, and there's a lot more. So as you go through your professional careers, going out of your way to help people, not just the patient, it does come back and it does pay off. And it makes you a better physician, makes you a better person. And also, don't look to be led. Like I said before, be proactive, explore everything. If you don't have a student interest group, you can try to start one. There are resources every year, more and more resources to help you with that. And of course, we have different national organizations and international organizations pertaining to rehabilitation. Usually medical students would join AAP and AAP&R, but don't forget about ISPRM and also ACRM. So I believe that is the end of the slideshow. I believe Hye-Jin asked me, she forwarded me a bunch of questions before from some of you guys. I think I answered most of them through this slideshow, but I think two of them in particular I saved for tonight. One of them was private practice versus academic. This one, well, I'm an academic person, but there are pros and cons to each. I think you would have to reach out to your mentors, go through the residency experience. There's different reasons to pursue each one. So that one I really can't answer very well today. And another person asked, I hear people often get burned out. Maybe just highlight why this may happen to physicians in a specific field. I think any field of medicine is at risk for burnout. I think if all the building blocks are there, and you've chosen things for the right reasons, and this stuff is genuinely exciting for you. I mean, there are lots of ways to prevent burnout too. So focusing on your own wellness is really important. But I do think that, from what I've observed, I think burnout really happens when we lose autonomy and when we sort of forget about ourselves and our wellness. So we sort of maintain those things. It may help. But I personally don't think I'm burned out. And I don't know anyone personally who really is, from what I see, but that can happen. And also for the APD, how will residencies be compensating for the lack of a step 1 score when reviewing applicants? What factors will likely become more important? Will step 2 scores just become the new metric? This is a question that may vary between institutions. I mean, for our program in particular, we don't really have a cutoff, and we've always prided ourselves in looking at the entire applicant. So, but theoretically, if a program did have a hypothetical cutoff and now it's pass fail, they would look to other metrics, but they should anyway. So things like your research, or away rotations or home rotations, and what your grades are with those definitely matter. But probably nothing matters more than your letters of recommendation. I mean, those are crucial. So I know that there probably is advice later on tonight about that, but when it comes to letters of rec in particular, the better the letter, the better it is, because that's really what piques our interest. That and your personal statement. I would put forth at least a little bit of effort into having a lot of reflection go into your personal statement and have it be personal. So that would be my advice for that. And I'll stop sharing my screen now.
Well, Dr. Liu, thank you so much for being so thorough and answering so many people's questions. So we're going to give Dr. Liu 2 more minutes to answer any lasting questions from the audience. So I'll take the first 2 questions that I see in the chat. So take a moment to do so. And let's see. And while that's going on, I just also want to put a little plug in. Let me just share my screen again. So Dr. Liu is very involved in everything. So this is really exciting that he's here tonight. But if you want to see him do another journal club, there is an AAP journal club that's going to happen next Tuesday. So feel free to see Dr. Liu on another side of, I guess, the PM&R world as well. So Dr. Liu, thank you so much for all that you do. Next up, in interest of time, we're going to move right along to the residency application season, because I know this is what a lot of the M3s who are on tonight are interested in. So we're going to go through different aspects of the timeline, and I'm going to have Nicole kick it off for us, and she's going to talk about away rotations and letters of recommendation. Nicole, thank you.
Thanks, Hye-Jin. Hi, everyone. My name is Nicole. I am a 4th year at Eastern Virginia Medical School, and I'm matched to Northwestern Shirley Ryan Ability Lab. Let's go ahead and jump right into away rotations. Why should you do one? It's a great opportunity to broaden your exposure to PM&R as a whole and to really build your network. You'll be making friendships, and they'll be your future colleagues and co-residents, and also opportunities to find mentors. This is a way to gain another letter of recommendation and also open a geographic region that you might not necessarily have personal ties to. So what to think about when deciding how many? Away rotations can be expensive because you're living outside for a month or more. You also want to think about energy, because it's an extended interview and you want to perform at your best, but also not burn out by the end. And 4th year is a pretty busy time. You'll be juggling ERAS submissions, also interviews. And so think about what, attention you have to be able to provide for each of these things. So that leads us to, when should you schedule it for? Ideally, after a home PM&R sub-I or rotation, if that's available to you, because you'll be able to get some feedback and work out some kinks before you're performing at a place that you're not familiar with. And if you're thinking about requesting a letter, at least a month before ERAS is downloadable by programs, because you want to give sufficient time for your letter writers to be able to craft a good letter for you. Some students really like the month of October, because that's when before the bulk of your interviews will be happening. And if your goal is really just to learn a little bit more about PM&R and gain exposure, that can be any time of the year. So some application tips. Be sure to check the website of the program that you're interested, because sometimes they may not be participating in the VSLO platform, and you don't want to miss out on those. Please submit early on the day that the programs begin accepting applications. But if that doesn't happen, that's okay. What you can do, especially for a top program that you're interested in, is to consider reaching out by email to the program coordinator or program director to express why that is your top program. I had some colleagues who were very successful with that. And remember that a rejection doesn't really mean that the program isn't interested in interviewing you for residency. So have heart. Conversely, an acceptance doesn't guarantee you an interview. So just do your best, work hard, and keep going forward. Let's pivot to letters of recommendations for ERAS. Generally, you want 3 up to 4, and that depends on the program. So again, check with their requirements on their website or in ERAS. And keep in mind that you assign letters to programs. So that means you can mix and match what letters you want to send to which specific programs. This also means that if you had a letter that you requested and it was uploaded to ERAS, but you decided that maybe I had some other letters that are going to be a little bit stronger, you don't have to submit that letter. Who to ask? A strong advocate will be able to write a better letter for you than someone who's well known in their field. But of course, if that person is both, that's fantastic. You want 1 to 2 letters from PM&R, and the rest can come from fields like internal medicine, family medicine, psychiatry, really any third-year clerkship. And also think about how these letters can be pertinent for the preliminary internal medicine and transitional year programs that you'll also be applying to. Try to ask as early as possible, at least 1 month's notice, and know that you can upload that letter into ERAS anytime after it opens in June. So really, it's not too early. How to go about asking. What I like to do is to ask to meet the person briefly in person to kind of ask about career advice. And this is a great opportunity to broach the topic of whether that person would be comfortable writing a strong letter for you. And if they say yes, go ahead and provide some materials, which includes a cover letter, a CV, personal statement if you have it, the ERAS letter of recommendation token request form, and deadlines. In that cover letter, you please include anecdotes, patient stories, or experiences and personal qualities that you would like for them to highlight. Basically, you want to make it as easy as possible for them to write that letter. 2 weeks before ERAS is downloadable, go ahead and send a reminder for them. And that's also when I really like to send a thank you note. And please keep in touch. They are going to be your advocates for interviews, ranking, and SOAP if you need to, and let them know where you match. They have a strong interest and are invested in your career and future. And so, yeah, that's they want to know what happens.
Hey y'all, I'm Jean-Luc. I'm an MS4 at UNC School of Medicine in Chapel Hill. And so I'm going to talk about ERAS, personal statement, and the supplemental application. So ERAS is divided into a couple of different sections. The first section includes demographic information. The second section includes medical school awards and honors, and this includes Alpha Omega Alpha Honor Society, as well as Gold Humanism Honor Society for those programs and schools that have it. You were also able to include your membership in any honorary or professional societies like AAP, PM&R that Dr. Wu mentioned. And then the bulk of your application really comes from this experiences section. And experiences are divided into work experience, volunteer experiences, and research experiences. Any job that you were paid to do or received a payment, you classify as a work experience. And any job that you did additionally to that you were not paid for would qualify as a volunteer experience. In this experiences section, you have about 1,020 characters to describe the activity. And you have 510 characters to describe why you left the position. There is much debate on whether you should do full sentences or bullet points, but my personal recommendation is to stick with what works best for you and keep that congruent throughout your application. In addition to the research experience section where you write about your research experiences, you can list your publications in a separate section. And then my favorite part of the application, and the part that probably came up the most, was the hobbies and interests section. So especially those getting ready to apply, think about your hobbies and go from there. You can also list your additional awards and accomplishments that may come up. This is just a quick example of the experiences section. You can see how it's laid out, your organization, location, you will list your position, the dates you did the experience, a supervisor if applicable, and the amount of hours per week also if applicable. And you see where your description is located as well as your reason for leaving. So transitioning a little bit to the personal statement, we just wanted to talk a little bit about the content of the personal statement and what our recommendations are. The first recommendation that we have is to show that you actually understand the field of physiatry or the specialty in which you are pursuing. One of the top questions I was asked is to explain what physiatry means to me. And if you can do so in your personal statement, that will really help you stand out. It's also helpful to include patient or personal stories. If you have a personal connection with disability or orthopedic illness that contributes to the field of physiatry, that is very important. Also, just important to know to avoid cliches in this writing of anecdotes or common problems that may not be impactful. In your personal statement, you also want to include your personal goals as a physiatrist or as a physician in your pursued specialty, and then how you can contribute back to the field. I think that is a very important portion of your personal statement and how you can give back to others through your work as a physiatrist. One other common thing that people do is they repeat their CV. It is very important not to do that in your personal statement. So when having people review your personal statement, my personal motto is to have 1 to 2 people who know you well review it first so that they get a sense of they already know you and see if all of your goals and passions and statements make sense to them. And then just as important, have 1 to 2 people who don't know you so well and see how the statement comes off to them. This is incredibly important because you can say things in your personal statement that you may not mean to say that, but that can be interpreted by people in different ways. As Nicole mentioned in her portion, it's very important to stay organized as you can attach different personal statements to different programs. And you do not want to attach the wrong personal statement to the wrong program. So please stay organized. I would suggest naming them with the name of the program. Some programs do require personalized personal statements. You can find this information on the program website or on the program overview on ERAS. That is very important to know which programs require personalized personal statements, because when doing so, you want to highlight unique opportunities that the program offers and how those opportunities align with your goals. And you may want to weave that throughout the personal statement or add it as a final paragraph in the end. For those applying to transitional years or prelim surgical or medicine years, there's also a potential opportunity to have a single paragraph in the end as to why medicine, transitional year, or surgery is beneficial for you and why you're choosing to pursue it in addition to your physiatry. Supplemental application is a thing that was started last year, and this is a process that PM&R is participating in. There are components of the supplemental application that we will talk about. This is the timeline for the supplemental application. This timeline will be shared with you. This was last year's, this is this year's timeline. And so it's important to follow this. Also, one thing to know that the supplemental application and the primary application are 2 separate things. You do not have to complete the primary application before you complete the supplemental application. But the supplemental application is due a bit earlier. The supplemental application is broken down in a couple of different ways. And you are able to list up to 5 meaningful experiences that may fall within the categories of medical or healthcare, research, volunteer efforts, or just a general experience. And instead of the 1,200 characters you had before, you have about 300 characters then. There is also an opportunity to describe any impactful experience encountered or overcame in your journey to residency, and you have about 750 characters to describe that. In addition, you can select up to 3 of 9 U.S. Census divisions and include a 300-character explanation to why. You may also signal if you would like to go into an urban rural area, as well as a short explanation why. There's also preference signaling on the supplemental application where you can list the programs that you would like to signal a preference to, and I believe PM&R has 4 this year. And so that is an important thing to pay in mind to as well.
All right, so my name is Hye-Jin again, and I'm going to be talking about the topic of categorical versus advanced program. And those who don't know me, I'm the MS for class president at Loyola University Chicago School of Medicine, and I'll be attending Stanford. So I want to talk a little bit about the language because we talk about categorical, advanced, so there's a lot of language going on. So let's break this down. So on this side of the I guess columns, we have the programs, and the same color code actually corresponds to what the definition is, so you know what's going on. So categorical and advanced kind of refers to the residency program overall. So categorical, think like comprehensive, is all in the same institution for your intern year and residency. Advanced, you can think of it as another institution. So you have your intern year and your residency at different institutions. So by default, if you do an advanced program, you have to do your intern year somewhere else. And that intern year is essentially your preliminary or transitional year. So you don't do both of them, you do one or the other. And preliminary is basically when you do your internal medicine or surgery year. That's the most common one, and it really focuses on those things. So if you go into a surgery surgery prelim year, you will be doing a lot of like surgery. So you'll be the surgical ICU, surgery rotation, versus internal medicine. It'll be the medical ICU, more cardiology, and some of the I guess electives you will also do through that. And transitional year is going to be multiple clinical disciplines. So you can need even a PEDS, family medicine, and even OB-GYN during your transitional year. So these are some of the ACGME specialties that require prelim year. Commonly anesthesiology, derm, neuro, opto, PM&R is one of them, preventive medicine, and red onc is another. And just kind of going back to compare them side to side to see what the benefits and I guess some of the costs are. If you're doing categorical, again, that is when your prelim year is not a thing. So you're just doing your intern year as part of the entire program. So you'll be applying and interviewing for the categorical program in the specialty of your choice. And you do not need to move twice because you'll be at that institution all 3 to 5 years, depending on what specialty you choose to go into. And you also have the benefit of being already familiar with the hospital at the start of your second year. Versus the advanced program, we talked about that intern year is not included, and you apply and interview separately for your intern year, and you also have to pay for them separately, unfortunately, and you'll be applying to them during the same cycle. So that begs the question, why do I just not do an advanced year and then just apply only to categorical? Well, there are like 4 main reasons that we can think of. So is very program dependent. So programs like Stanford and Columbia for PM&R, they only have advanced programs. And programs like UPMC and UW, they offer more advanced program than categorical. And location-wise, you may want to spend a year next near your family, friends, significant other, support network, etc. And some people want to be adventurous and live somewhere exciting for a year, Hawaii. And some people have moving logistics, so they want to stay near their medical school for an extra year as they're waiting for their significant others to graduate. Maybe they're finishing some research and they just may not feel like moving yet, which is perfectly fine.
All right, hello everyone. My name is Ymi. I'm currently a medical student at Albany Medical College, and I recently matched at NYP-Columbia Cornell. And today I'll be talking to you about virtual interviews. So just a quick disclaimer, the advice I'm about to give you is based off of the interview process we had this past Match 2022 cycle. It might not fully reflect the Match 2023 cycle, as there's still active ongoing discussion whether there'll be in-person interviews or it'll be fully virtual. All right, so first, when are interview invites sent? So they can be sent anywhere from right after ERAS submission, which is usually in October, and can be sent all the way up until January because interviews tend to wrap up in January and February. Just keep in mind, there are some specialties that have universal interview release dates, so such as OB-GYN and orthosurgery. So in those cases, those specialties may not abide by this timeline. Invites are usually sent out on weekdays during business hours, but it's not always the case, so keep that in mind. It's important to know that interviews are extremely time sensitive, so interview dates as well as times fill up fast. So it's really important to keep your phone or device with whatever you're using on you to schedule it as soon as you get the invite. Or let's say you're on an airplane, you can't do that for whatever reason, make sure you have someone else that you entrust to do that for you. It's a good idea to set up it's a good idea to set up notifications to be sent directly to your phone. And of course, make sure you're responsible. So if you're on clinical duties, be respectful and tell your attendings or residents that you may need to step out during rounds to schedule a time-sensitive interview. So where can you receive invites? So typically you can get them through My ERAS. So you can get them either through the interview scheduling tool or through the message center, which you can see with the red arrows. You can get them through Thalamus via email, Third Friday, or you can even get a phone call directly from the program coordinator. So when should you be scheduling interviews? So obviously it's going to be dependent from individual to individual, but some things you may want to consider are if you have clinical obligations that you have to do, the fact that programs do have a limited number of interview dates that they send out. Make sure you're genuinely interested in the program, because if you don't actually see yourself going there, be considerate and think about other applicants who may really want to go to that program. Think of how your interview performance may change throughout the season. So do you think you'll perform better earlier or perform better later? And also when you're scheduling, you may be enticed to schedule interviews back to back to back within a week, but how do you think you'll perform by your 7th interview on Friday? So keep that in mind. So preparing for interviews. So we have a perfect model on the right-hand side of this slide here. So the most important thing is to know your program. So you can, obviously go through the program website, find information there. You can attend virtual residency fairs. So I know PM&R Scholars has a great one on YouTube. You may have direct contacts in the program itself. So maybe current residents, for example. Make sure you're triple checking the date and time of the interview is very important, especially if you're on a different time zone than the program. So again, triple check that. Interview setup, make sure you have clear audio and video. Very good lighting so the interviewer can see you, a plain or minimal background, stable internet, of course, a quiet room without distractions. Make sure you look professional in your attire, your makeup, your hair. It's definitely okay to have notes next to you as you jot down things that are important throughout the interview day. And I'd highly suggest to attend pre-interview sessions. So like resident meet and greets and happy hours that usually are scheduled before the interview day itself. So common interview questions. So obviously it's not an exhaustive list, but these are questions you'll be likely asked on the interview trail. So be prepared to tell the interviewer about yourself, why PM&R or other specialty you're applying into, what are your specific interests within that specialty, why are you interested in that program you're interviewing at, and why do you feel like you'd be a great fit for that program. Some interviewers ask you, what questions do you have for me? So the whole 20 minutes, you should hopefully have a list of questions ready to go. Anything on your ERAS application is essentially fair game. So make sure you're ready to discuss any of those things. And you may be asked behavioral interview questions. So they may start off saying, tell me about a time that you worked in a team, et cetera, and be prepared to talk about experience and the significance of it. So last thing after the interview is always a good idea to send out thank you notes, especially to people they had meaningful interactions with. So definitely the program coordinator, because they put a lot of effort in your interview day. PD, APD, any interviews you had, again, a significant interaction with. Except it's really important if there's programs and specialties that explicitly tell you not to send thank you notes. There's some that have a policy of no post-interview communication. If that's the case, do not send them anything.
Hi everyone, my name's Kat. I currently attend Western University of Health Sciences, Comp, and I'm matched at the University of Washington. So I'll be talking about program ranking. So first, I just want to define ROL stands for rank order list. So you'll be seeing that very much along the whole process. And also NRMP is not the same as ERAS. So ERAS is where you're going to submit your residency application. NRMP is going to be where you submit your rank list. So because they are separate entities, there is another fee. So it's $85 to participate in the match. And you'll typically sign up for that right after you submit your ERAS. And then you'll need NRMP codes to generate your rank order list. So you can get that from your ERAS application, where just go to the programs where you get interviews, and then they'll have their NRMP program code there. And that's what you'll input into NRMP to generate your list. And you'll have primary and supplemental rank order list. So the primary is going to be where, like, for PM&R, you're going to be putting your PM&R programs. And then each advanced program is going to have a supplemental rank order list where you'll put your intern years. And there is a fee if you have more than 20 unique ranks. So NRMP will charge you basically if you have that for any of your rank order lists. And this is different from ERAS, where you can submit your rank order list multiple times. So I know a lot of people end up actually submitting it multiple times and just submitting, seeing how they feel, and then readjusting as needed. But you want to make sure you submit early and have that final submission like at least a couple of days in advance, because it could crash just like ERAS. And then throughout this whole process, just shoot your shot, basically. So the algorithm favors the applicant. There's like this really long process of like explaining the algorithm, and NRMP actually has a pretty good video on YouTube explaining it. So I would just look over there, and then Nicole's going to put the link to that video in the chat as well. So when it comes to time to assembling your rank order list, you want to think about what's going to make you happy and like what are your non-negotiables. And you want to discuss this with like your loved ones, like mentors, people who your rank list will essentially affect, like significant others or family. And then trust your gut. That's what everyone said. For me personally, I had difficulty just making this huge decision off my gut. So I made a spreadsheet and compared my two rank order lists from my gut feeling and then my actual spreadsheet. And then post-interview communication. So some programs will send out love letters and they'll just send out a lot of encouraging things, which is really nice to hear. But the general consensus is don't let all of those communications and like love letters affect your rank order list. So you're going to want to make your rank list based off what you want, not necessarily how you think other programs will rank you. And then once you have assembled your rank order list, you're going to want to send a letter of intent to your top programs. So some people will send them to like their top 1, and some people will send to top 3 or top 5. And it's really up to you how you want to do that. The most important thing is that you don't tell multiple programs that they're your number 1. And then in terms of timing of when to send your letter of intent, you'll want to send it at least like no later than 3 weeks later than your last interview. So then that gives you enough time to kind of process and make a decision. But then it also gives the programs enough time to like receive the letter of intent. So the things that you want to think about, this is kind of like the most common things that people will take into consideration. So like location, weather, like region in the country, if they have family support there, or if they have opportunities for their significant other, if someone's moving over there with them, as well as like job opportunities, fellowship opportunities, leadership opportunities, research opportunities that the program can provide, as well as special opportunities for areas of interest, such as like performing arts medicine or sports coverage or adaptive sports. And then people will also take a look at like facilities and also the vibes of like the residents as well as faculty, and if you can find mentorship there. So this is a pretty long list of other things that some people will look at. It's definitely not exhaustive considering everyone has different like things that they are looking for. So the ones in black I already talked about, and the ones in white I didn't mention yet. And then if you just do the survey at the end, you can get a copy of this slide. So you'll have this for your own personal use. So this is an example of what a rank order list will look like. So some things I want to point out here is that if a program has categorical and advanced, then you put both of them on your rank order list and they count as separate ranks. So, and you can keep them together like in program A. So say you're really interested in a program, then you can put them together to increase your chances. Or you can separate them like program D, where you can put categorical and advanced separately. So a lot of times people with like families with young children, they don't want to move their family twice. So they'll put categorical programs over all the advanced programs. And then another thing I want to point out is that every advanced program has a supplemental ROL. So on the next slide, then you can see that, where this is going to be where you're going to put all of your intern year programs. So your prelim medicine, prelim surgery, as well as transition years. And this, you can have a different supplemental rank order list for every single advanced program, or you can just have the same one. It's really up to you. So you'll just have, there's no limit as to how many you can have, just label each of them to make sure you're knowing like which one you're putting with which. So then this pretty much concludes this part of the session. So now we're going to move on to the panel discussion and Q&A.
Well, thank you so much to all our panelists. So we're going to move right along to the panel discussion, and you have all sent in really wonderful questions. So we have vetted very much the FAQs of that. And this is also a time for you guys to also put some questions in the chat. So I will go back and forth between our pre-asked questions as well as some of the audience chat. And I know we have a few more questions regarding just some of the advice. So we're going to actually show you guys some slides now. So a lot of questions regarding a weight rotation tips for success. So Nicole's going to walk us through a little bit about some of the sources you can use.
Yes, I think first and foremost, the residents and attendings that you'll be working with know that most students don't get much PM&R exposure. So I think as long as you go in with a positive attitude and be a sponge, absorb all the information that you can, and that's all that they're looking for. If you'd like to prepare, we split some resources into primary and secondary, the primary ones being a little bit more relevant and at a lower cost. I'll post some links in the chat very soon. And the secondary resources are ones that are more relevant for residency. But if you have a chance or access to them, absolutely go through them. They will be a little bit more expensive though.
And then a lot of questions about resources. So we have broken up the resources into PM&R specific and ERA specific. So just take a moment, just kind of take a look. You don't need to jot anything down because we will send you guys the PowerPoint if you guys complete the survey later on. But just want to put a quick plug in for PM&R Scholars Virtual Residency Fair. I believe it should be happening this summer as well. So keep an eye on for that. And last year's virtual fairs are also recorded as well. And you can also refer to the chat to see the resources that Nick or lovely Nicole has put together so nicely. And these are more ERA specific resources that you can also take a look at your own leisure. Just a couple things to point out. AAMC has a really great video about the supplemental ERAS application, Frida through a AAMC and Doximity, so you can just keep track of your rank list and whatnot. So those are some of the resources that we would love to kind of share with you. Well, that kind of wraps up the time for our panelists. So I want to just thank them for it. And we just kind of leave you with some final words. Just know that this is such a long process, and yes, it is such a marathon and not a sprint. And just know that you are enough in this process, and that success is not final, failure is not fatal. It is your courage to continue that counts. And please be supportive of each other throughout this process. I just want to make a claim that all these wonderful humans on this panel tonight, I met them on the interview trail. I just literally randomly DM'd them and they became some of my dearest friends, throughout this process. So yes, it's possible to make friends in this process, even though it's virtual. And I think at the end of the day, no matter which field of specialty you go into, it's still small enough, you will run into people again, and you want to be surrounded by people who empower you. And so I just want to leave you guys with this. Feel free to reach out to us on social media. I know some of our participants asked if they can share theirs. And so please share your own social media on the chat box so you guys can also connect with each other. And with that, please take a moment to take out your phones and just take a moment to do a brief, like a 2-minute survey. And I will ask for your email at the end, and we will send you out the Prezi PowerPoint tonight as a little thank you for filling out the survey. Thank you so much and have a wonderful evening.